Hi, everyone. Welcome to the very last Reach Higher event of the school year. My name is Lizzie Gray, and I'm a project coordinator for Connected Lane County. We'd like to kick off this panel by thanking everyone who is tuning in live and who's returning participants from our other Reach Higher events. We've had some really insightful and lively conversations around the local tech and manufacturing industries, and I'm very confident that today's event will be equally engaging. Joining me in this Q&A style discussion around the healthcare industry are 4 professionals currently working within it. I'd like to give you each an opportunity to introduce yourselves and the healthcare organizations that you represent. Let's start with Sonia.
Okay. I'm Dr. Sonia Sproul. I own my own dental practice and bought it from my dad about 7.5 years ago. Long time practice family, so it's been fun to continue that. And then, have a great team of ladies. It's just myself as a dentist, and love what I do. Love, sharing about my career, and excited to maybe inspire some people. So
awesome, welcome. Jacqueline, would you like to go next?
Hi, everyone. My name is Jacqueline Moreno. I'm the prevention strategist in Lane County Public Health in the prevention section. So my job is to manage a portfolio of prevention programs that are funded by our local coordinated care organizations. And I've been in my position for a little over 3 years.
Wonderful. Welcome, Jacqueline. Lauren.
Hi. My name's Lauren. I work at Springfield Family Physicians as a medical assistant. I've been working at Springfield Family for nearly 8 years. I started out as a student and was hired out of my externship. I worked for the same provider the entire time, just kind of as his right-hand woman, just up until recently. And I'm in the nursing program at Lane as well. So now I've dropped down to part-time, and I'm a float helper around the clinic, just kind of helping out.
So not busy at all, just trying to work.
Oh yeah, no, it's cake.
Awesome, thank you for being here.
Yeah.
And last but not least, Sarah.
Hi, I'm Sarah. I am an oncology nurse at Riverbend Hospital in Springfield.
Wonderful. Welcome, Sarah.
Pretty easy job title.
That's great. Thank you all again for being here. When our participants who are tuning in live registered for this afternoon's panel, they submitted a question or two that we'd like to address. And I'll kick off the Q&A by asking each of you, and we'll go right back to Sonia, about what your career path into your current role looked like. And I'd love for you to include education, certifications, anything that got you to where you are today.
Okay. So it kind of started in college. I did a major in biology, not required, but most of the classes that are required to get into dental school are most sciences. So it just made sense to end up majoring in one of those. And then I took a year off actually between, getting to college, majored in biology, took a year off between dental school and undergrad. Don't have to, I just needed a break from school. And then I was able to focus on applying then my senior year, because it usually you apply kind of the year before. So applied my senior year. There was a admissions test that you have to take. Usually there's an interview. It's kind of an extensive application. I went to a smaller undergrad, so I had a lot of help in preparing me for that application process. Got interviewed by a couple schools. Most of the time they want a secondary application involving anywhere from your grades to letters of recommendation, personal statements, or just kind of answering some various questions. And then that dental school was 4 years, completed that. And then while in school, there's 2 board tests. There's part 1s that typically are taken at my school. It was after the first year. And those are all your basic sciences. And then part twos were after typically your junior, senior year, your last two years in dental school, are more clinic-based. So those are more clinic-based boards. And then there is a live patient portion as well for treatment that you're graded on. And that was part of I took the REB, so the Western Regional Board. On the West Coast, I think that's the most common one, but, and then that's the license. And then depending on what state you want to go practice, then you have to apply for a state license. And that was pretty basic. You just submit your proof of passing your boards, your licensing, and then taking a jurisprudence exam and passing that. So I hope I answered all of that.
You did. A lot of steps, a long process to get to where you are. Yeah, absolutely. So
it goes fast, believe it or not.
I'm sure. And I do want to address really quickly Kelly, who's an educator in our area. A lot of the folks tuning in are either health sciences teachers or some are students. And so Kelly's an educator, and she threw in just a warm reminder that some of the students on the call might not have a couple of years of classes in their background. And so if we could do our best to, and I'll try my best to ask questions, but just to limit or explain professional technical terms, just so that everybody on the call knows exactly what we're talking about. And I have no medical experience, so I'll do my best to ask as I hear words that I don't know either. But thank
Absolutely.
you. All right, Jacqueline, how did you land where you are today?
When I was an undergrad, I changed my major a number of times. I thought I wanted to pursue something in dietetics or nutrition. And after going through a couple of the chemistry courses, I decided that was not the route for me, but I did discover public health. I was really inspired just by some of the research around health disparities. So knowing that depending on your parents' income or the color of your skin and so many other socioeconomic factors just about where you live and how you were born, that there are so many things that go into health, that public health would address so much of that. So I pursued a master's in public health. My master's is in health education and health promotion. As far as my title now as a prevention specialist, I want to clarify. So when I talk about prevention, in Oregon, we refer to prevention kind of as substance abuse prevention. So most of the folks in my department work on substance abuse prevention, particularly for youth. But health promotion can, look like campaigns about healthy eating or mental health promotion and trying to create or decrease stigma around seeking mental health services, things like that. So there's definitely quite a realm of topics in public health. And as far as how I got here today, I worked for several years at a university where I worked with young people trying to get them to reduce their alcohol consumption, binge drinking, cannabis use, all of those risk behaviors that, kind of stereotypically some folks associate with college life. And then from there, I taught public health in community college or university level, and then I landed in public health.
Was all of that experience either at the college or community college, was that here locally?
No, so in Lane County, my position at Lane County Public Health is the only job. I moved here from Southern California, where I went to school.
Okay, got it. Thanks, Jacqueline. Lauren, how did you get to where you are?
Well, I started out going to college, just taking prereqs, thinking I was pursuing a degree in something completely different, actually. And wasn't really sure what I was doing. So I actually started out as like a waitress, and just really got to a point where I wanted something that brought me a little more purpose. So I decided to do the medical assisting program because it was a 13-month program, so it was pretty rapid. just to kind of get my foot in the door into a medical position to see if I liked it. I wasn't 100% sure that pursuing a degree in medicine was what I wanted to do. But once I got here and I had been here for, I don't know, maybe 3 months, I realized how much it gives to you. And I just kind of decided to learn everything I could while I was here. So like I said, I'd spent the time with that one provider for so long, just using him as a mentor, and kind of helped me decide that I wanted to pursue even farther. But ultimately, being a medical assistant, it opened that door for me. It gave me great hours. I mean, I just really like, working in the clinic setting and working with the patients. And primary care is the office that I work in, and you're able to develop a lot of patient relationships. So I had a panel of about 1,200 patients before, up until recently, and I know so many of them so well. It's just it's really fulfilling. Ultimately. But yeah, it started out as not that direction at all, and just a risk that I took, and it ended up panning out very well for me.
Good for you. Was that Lane's medical assisting program?
So no, Lane's program is a little bit longer. I did the accelerated program at Pioneer Pacific before it closed back in 2013. I did complete my associate degree at Lane, though. Private college is not something, it's fine to do certifications through, but they don't generally carry their associates on to other colleges. Other colleges don't typically take their credits. So the certification is nationally good though, but I decided to do my associate through Lane so I could transfer anywhere when I finished my bachelor's.
Okay, that makes sense. And you mentioned that your schedule is pretty predictable and regular. Is that because you work in private practice or a family practice?
I think typically working outpatient of a hospital, the hours are going to be pretty much a Monday through Friday situation. Our clinic does have evening hours and Saturday hours just to kind of reduce the use of urgent care and emergency room for the community. I definitely started out working a lot more evenings and Saturdays just to kind of help. But through the years, yes, it has become much more. So I get to pretty much pick what I want to do. So, I mean, it's flexible. There's a lot of us here. So, yeah, it just kind of depends. But yes, typically it's a daytime.
Okay.
Monday through Friday.
Which I'm sure is an incentive for many people.
Huge incentive.
Yeah, absolutely. Thank you, Lauren. Sarah, I think you might be our most recent grad. So I would love to hear about what your journey's been. And I also love your visitor.
Yeah.
Please meet
Thank
my
you.
visitor.
This is Chonk.
Oh, so
yeah, so I graduated about a year ago. Actually, yeah, like a year ago, 2 days ago.
wow.
So I kind of knew I wanted to be a nurse starting pretty young, just because my mom's a nurse, my aunt's a nurse, like there's a couple different nurses in my family. And so it just so happened that when I was in middle school, we had like a mentorship program. And at that point, I was lucky enough to be able to do it in the hospital. They're not so lenient anymore. So I did that in the neonatal intensive care unit, which is with the tiny little babies that are really sick. And I really liked it. And I thought that's what I wanted to do for a while. And so then in high school, I just kind of continued. I just saw a question about medical classes in high school. I didn't take any. I was a part of the International Baccalaureate program. So I didn't have the opportunity to take the medical classes like some of the other students did. But I'm really glad I ended up taking the IB classes just because it prepared me to get into the school that I wanted to get into. So then in high school, I did a couple different volunteer opportunities at Riverbend as well. They're, you know, kind of mild, like a lot of desk work and stocking and things, but you just get to like make connections and things like that. So I worked in the post anesthesia care unit, and then I worked in the anesthesia clinic. They're both just sort of like surgically related. Again, just kind of getting the foot in the door, not really anything I was super interested in. And then I actually applied early decision to University of Pennsylvania. I didn't apply to any other schools. Just kind of took a leap there, and I applied directly into their nursing school. I originally thought that I wanted to be a doctor. For a while, I went to a medical camp at Georgetown University when I was a junior in high school, and I really liked it. I liked a lot of like the surgical aspect of things. So I liked that when I applied to Penn, they have like a variety of different schools. They have a college, they have an engineering school, a business school, a nursing school. So I thought that I could kind of do the nursing school and then see if I wanted to do like follow it into being a physician. And I also liked the idea of having a nursing background as a doctor, because I think that a lot of the physicians in the hospital kind of forget what it's like to be a nurse, well, or they just don't even know. But then I realized that I did not like the medical classes in the slightest. Like I didn't feel like I was learning anything that like really interested me. You know, I knew a lot of people that were graduating pre-med that didn't really have like even close to the knowledge that I had, and I was going to graduate in 4 years and have my degree. So I did a 4-year nursing program. And like I said, I graduated in May with my bachelor's in science and nursing. And from there, it was honestly really hard graduating into COVID, because a lot of what we do as new nurses is try to get into new grad residency programs. And so that basically just means it's like a program where they incorporate like classes, and they understand that you're a new graduate, so that they try to, you know, understand that you're newer and you don't know everything, and they just kind of bring on other like panels like this, honestly, like we do a lot of stuff like this. And most hospitals canceled like all their new grad residency programs because we are expensive to train, and they were overwhelmed with COVID stuff. So I didn't really plan on coming back to Eugene, but I did, because there's a new grad residency program open at Riverbend. So that's what I'm in right now. I got my job in July, and I took my nursing boards in August. It's called the NCLEX. Really hard, honestly. It was like the worst couple hours of my life. I thought I failed it completely, but if you just get through it, you study, you put the time in, and you'll pass if that's what you want to do. And then yeah, once you get your boards and you have your license. And I started working in September with some residency class stuff. So I have a class once a month where they bring in panelists. We talk about our experiences. We learn. We're doing like a new graduate project at the end of the year. So my project's about medication safety. So they're kind of incorporating all that stuff. And like I said, I work on the oncology unit now, which is cancer patients. But it's also a lot of med surg, which is just medical, surgical, very like anyone who's sick comes into us. You know, they have the flu, they have an infection. Just because of COVID, they shut down part of our medical floor to be a COVID floor. So now we get a lot of overflow. So I really honestly don't work a whole lot with cancer patients, but some. And I mostly just do lots of hard work. But it's really awesome. It's really it's a good job, and I make a lot of money as a new graduate.
Yeah.
A lot more than a lot of my friends.
Yes, I have many nursing friends, and they're doing quite well.
Yeah.
Yeah. Kelly actually threw another question in the chat, and Ricardo, I will get to yours, but it's specific to Sarah's comment about the NCLEX. So how does that work? How does getting hired after passing the NCLEX work? And there's another question that asks, what would have happened if you hadn't passed?
So honestly, a lot of people don't pass on their first time. I had friends who were hired and then didn't pass their NCLEX. Yeah, basically they were just like, you have to have passed by your start date. And honestly, Riverbend's pretty understanding. I think that for some of my friends who were concerned, like I had a friend who I'm pretty sure like literally took the NCLEX 2 days before our residency program started, like found out she passed and got to get going with it. But I think they told her like, if you don't, then they'll just put you into the next program. So the thing about the NCLEX is if you pass, I'm pretty sure you have to wait. It's either 30 or 45 days until you can take it again. So that's kind of the hard thing. So if I hadn't passed it, I took mine, I think August 11th, and I started like September 16th. So if I hadn't passed it, I don't think I would have made the cutoff. I might have. No, I don't think I would have. So I would have probably had to go into the next cohort. And honestly, that was kind of bad planning on my part. I was like really putting off taking the NCLEX because I didn't feel prepared, and it's like really nerve-wracking to like put your whole license into one day. And so I was kind of pushing it off, and I didn't really know that I was going to take this job at Riverbend when I was planning, and I had planned to like study a certain amount of time. So honestly, if I was going to do it again, I would literally just study really hard 1 month after graduation and take it right away, and then just get it over with and enjoy my life afterwards, because it's stressful putting it off. But yeah, I mean, they're pretty understanding. Some jobs, they'll rescind your offer if you don't pass the NCLEX. And usually if you don't pass it twice, they're kind of like, I don't know if I want you if you don't know all that information. But honestly, it's like, I don't think I learned anything from the NCLEX. You learn it all on the job. So I think it's kind of a stupid test to like base your whole career off of, but that's what we have to do. So
but it's there. Okay, good advice.
Yeah.
Good advice. To address Ricardo's second question, I think I'm going to go to Sonia, because you recently, I think you said 7 years ago, purchased a practice. Did you take any business classes, or did you just kind of jump into it?
I jumped into it. I wish I would have taken business classes. That I was in high school, I actually took pretty much every art class you could. I was thinking of graphic design. So I kind of was catching up with the sciences when I went to college. So I didn't have a whole lot of time to put in other types of classes to kind of create a well-rounded future business owner, as you would say. So I took over. I was in a special situation where I had my dad. I relied on him heavily. He was a great mentor to me. And then just tried to reach out to a couple other people who, some females in town who were in my same field, just because I think it's a little different to be a female employer, especially when most of my employees were older than me. So I learned on the job. Honestly, I think business classes would have helped, but it is throw yourself into it and figure out as you go. So I think just giving yourself grace, and I took a lot of CE on dentistry, but actually more on running a business and kind of how do you look at balance sheets and profit and loss statements and just stuff that you'd have. I don't even know what that was when I started.
Sure.
So so if you have an opportunity, I would say do it just to familiarize yourself. But on one hand, you're going to do a lot of on the job training and find some good mentors.
Yeah, absolutely. Thank you. Okay, so I have a fun question, and that's just, what characteristics or qualities do you think make you successful in your job? And let's start with Jacqueline.
I think the main thing for me would be just having a systems point of view. So in public health, just so many different things are connected. So we can't, well, let me back up. So when you go to the doctor, you might be going for a certain symptom or a certain condition that you're trying to treat. But in public health, I feel like we really look at not just the individual, but at the health of families and communities, and trying to understand all of the different environmental and policy influences that are influencing people to make certain decisions about their health or just the outcomes that they're having. And so being able to kind of grasp all these different moving parts in a community, I think, is really important. There are certainly people who want to specialize on a certain topic or a certain skill. So there are people in public health who are just very focused on communications and social media, because we need to be able to communicate with the public about certain health behaviors. So even things like getting a COVID-19 vaccine or wearing a mask, you probably see those images and campaigns and messages all around the community. Like there's someone in public health who is developing that. but there are also a lot of people who are trying to figure out how all of these different things work together. And so, yeah, that's, I feel like what I try to bring to the table.
Okay, thanks, Jacqueline. Lauren, what characteristics or qualities make you successful in your role?
Well, I think that ultimately, I mean, I'm a kind, compassionate person. And one of the biggest parts or the hardest things for patients when they come to the doctor's office, especially for the first time, is trust and feeling heard. And so I always tell trainees when they come on, it's incredibly important for the assistant to set the tone for the entire appointment. So you have to be upbeat, you have to be friendly, you have to be caring, understanding. It doesn't matter what they're here for or what their social past is or anything like that. It's very important to make the patient feel very comfortable and safe. And it's important for them to trust you by presenting yourself as confident and competent. So otherwise they're not going to trust you, and then they're not going to trust the physician that follows in after you. So that's probably what I try to bring every day to it.
Yeah, that's so true. I learned just recently too that empathy is a professional skill. It's one of the top 10 professional skills, and that's cross sector. And I feel like it applies in healthcare more so than anywhere. But yeah,
not everyone has it for sure.
But we can practice it.
Yeah.
What about you, Sonia?
I mean, a lot of what Lauren said, actually, I totally agree with. It's not a surprise that everyone hates coming to the dentist. No one likes it. It's you're kind of in someone's personal bubble. You're looking at them upside down, laying down. So it's, I think I have an amazing group of women that I work with, and I think we really try and give a person a great experience from the phone call to whenever they come in, whoever they're seeing, really good communication. And then I love what I do. I think that shows. Really, like Lauren said, building trust with a patient, not treating them as you're at a used car sales, and this is what I want to sell you, overall treating the overall health, and then just making people feel comfortable. It's a fun place to be. We have fun at work. It's a safe space. Yeah, doing good work, and then treating people like people, and hearing what they have to say.
Yeah, that's great. My dentist remembers details about me that I forgot I told her, and it makes me so much more comfortable, and I get excited to go see her. She was the
awesome.
first person I told after I got engaged, because I happened to have a dentist appointment the next day, and she was just as excited as a family member. So yeah, that's a great point. Sarah, what do you think makes you successful as a nurse?
Yeah, I mean, similar to Lauren, like we just have to you have to put everything that's going on in your own life aside at the door so that you can treat other people like with all your compassion, all your empathy, like give everything you have for 12 or 13 hours and then go back to your regular life. So that's kind of hard. But I mean, beyond that, I think time management's really big in my job, just because we're on the go. We have typically around 6 patients. I work on night shifts. So I'm working with 6 patients a night, trying to get all their medications done, all their assessments done, tending to everyone's needs, getting yelled at by everyone because everyone thinks the nurse's fault all the time. So you kind of have to have thick skin. Sometimes, I've been called a lot of names. I've tried to have my bones broken. I've been tried to get punched, like you have to be able to really like stand up for yourself and stand up against what's going on, and also like communicate with the healthcare team. You have to be able to stand up against providers that don't want to listen to you. You have to be able to stand up to like your assistants. You have to be able to stand up to a lot of people and stand up for yourself and stand up for your patients, because honestly, that's who you're there for. You're not there for anyone else. So I think that's something that's learned and honestly really hard, but it gets better. It's easier. But I also think, honestly, I mean, sometimes it's not awesome to be young because patients think that you're not qualified to take care of them. which is kind of hard to break through that barrier. But at the same time, I think it's really helpful for me because I'm like, I don't really have that sort of like, I haven't been there for that long. I don't feel like I'm over like worked or over the job at this point. And I have, I feel like a lot fewer preconceived notions about my patients, like, which is nothing to say anything against like someone who's been in the field for a really long time, but they may have seen like this same come in 17 times, the 17th time, or like not answer this call. Like I know they're just going to ask another patient, or I know they're just doing their notes, whatever. Whereas I feel like who, I don't care, like that I don't care what someone did, I don't know what they came for, I don't care if they came 3 times this week, addiction, I'll still do them the same way, and I'll look into
Hey, Sarah,
more
sorry.
as like,
Can you hear me okay? Your sound is cutting in and out. I don't know if I feel like it's happening for others on the call. And so it's hard to follow exactly what you said.
okay, see if I this one.
Oh, it looks like it might be that. But I
Here.
think we got, for the most part, the fact that being new, you're not as jaded potentially, or you aren't gonna
Yeah,
think that a case is something or it's not something because you've seen it 10 times. You're gonna treat it like a new case every time.
yeah, exactly. And like just take extra time. Still kind of
Yeah, it is.
really can come maybe.
Sure. Yeah. Yep. Absolutely. I will. Okay. Let's hop on over to the question of, so actually, I think Lauren, I'm only going to ask this to Sonia and Jacqueline because in your job, it might be very obvious, but can the other 2 ladies tell us when you use math in your job?
Math.
Mm-hmm.
I mean, every day to a certain extent.
Sure.
Every day you're counting teeth, seeing what's there. That might sound kind of funny, but I'll use math kind of in 2 different ways. I feel like clinically with more like the dental job, not as much, but it's more kind of counting, like very, very basic math.
Okay.
Like certain products that we use have to be mixed or set for a certain amount of time. So like, for example, this might get into the nitty gritty, but if I know I have a couple of patients lined up to see in some exams and I'm about to start a procedure, and it's going to be an uninterrupted, X amount of time, I kind of count backwards. So I kind of, it's like time tracking, counting. I would say more like typical math type would be on the business side.
Okay.
With just looking numbers, probably more in what an accountant or someone who deals with like finances would do. In terms of reading just basic adding, subtracting. In terms of like a spatial, that's more of you're not your typical math, but kind of a 3D. Sometimes we're working with different shapes or kind of creating, like seeing, here's a loss of tooth structure, and you kind of visually want to build something back up, but you want it to look, if you want to have something else that your eye is going to, tell small differences in terms of looking at 2 front teeth, you want the other front tooth to match what's already there. So just kind of spatial awareness. So using math, but kind of in different ways than how you probably took it in school.
Okay, great. Jacqueline, do you use math in public health?
All the time. This is a really fun question. I appreciate that response a lot, Sonia. Yeah, I use math all the time. I mean, in COVID, we are constantly calculating case rates, and now we're looking at vaccination rates, and so I feel like there are people who are computing all the time. for me personally, kind of in my day job, I manage a pretty significant budget every year. And it seems like every day I'm working with numbers, trying to, find new projects that we need to fund and balancing that budget. And so I use a lot, I use Excel a lot to try to manage all of those numbers. But yeah, when I selected my career, I don't feel like math was something I was super passionate about, but in grad school, I took some biostatistics classes, and I just learned about how important data and numbers are to telling the story of health. And so it's definitely been an acquired taste for me, but definitely use it every day.
Okay, great. Thank you. Lauren, I'm going to direct this question to you. Lily popped into the Q&A and she asks, when something hard comes up, is it hard to sometimes control your emotions?
I think that there's the kind of this stigma in healthcare that you are not supposed to have emotions while you are caring for patients. But over the years, I have just firmly decided that is completely impossible, especially when you get to know and care for patients, or even if you don't know them and they're strangers. But it can be very hard to try to separate yourself when you have, say, a patient have something tragic happen to them. It can be hard to sort of kind of rein it in and be like, okay, well, let me actually just logically think of what I can do that will improve your situation or help you get to where you need to go. There's also been many instances of you're very angry at maybe the way you're being treated. Not everyone is happy about what happens at the doctor's office. So I've spent a lot of time here just kind of learning to realize that even if they're mad, it is definitely not, it's not about me, it's about the situation. I'm gonna just get yelled at, and that's okay. We'll come back to this when you're ready. But just kind of compartmentalizing and realize it's not personal, it's situational.
Sure.
It's become more manageable with time.
Okay, great. Thanks, Lauren. There's kind of a follow-up question that's in the same vein. Sarah, and this will be a great opportunity to test your sound, but Ricardo asks, how do you carry on after losing patients, being that you work in oncology?
Yeah. Do we think the sound is working?
Yes.
Yay. Okay. Honestly, I thought that was probably going to be the hardest part of my job, was losing patients. And it's really hard. It is hard, honestly. Like it's kind of a weird feeling. Like maybe a week or 2 weeks into my orientation on the unit, there was like a really traumatic code blue, which is like when someone dies, like their heart stops beating. And I feel like that kind of just set the tone of like, we see really dark stuff in the hospital, and that's just kind of, you just sort of get used to it. And like, obviously that was sort of like the extreme end of that spectrum in terms of like the kind of dying that we see. So we actually get almost all of the dying patients in the hospital, even if they're not dying from cancer, something that we call comfort care. And we mostly get it on our unit just because we're extremely comfortable with hanging things like morphine drips or Dilaudid drips. Those are just like really high intensity narcotics. And a lot of other units aren't comfortable, hanging a drip of morphine at 20 mLs an hour, which that's a lot. We normally give morphine in like 1 milligram increments every few hours. So we're giving like really high intensity medications to keep people comfortable. So I'm extremely familiar with dying patients now. I kind of feel like at this point, you just have to put a different spin on it. You're just like the last person, help them feel the most comfortable before they pass on. And, you get to sit there and hold their hand and say something to them while they're passing or whatever it is. I've been with patients that the moment they've passed, or, you're just keeping them comfortable, and the next time you go in, they've passed, and you do whatever you do. I think as I become more familiar with patients who do come back more and more, and they, especially our oncology patients that don't have great outcomes, I think those start to take a little bit more of a toll on you when it's someone that you've taken care of months and months and months, and then you know that they're going to like eventually come in to be comfort care or something like that. It's a little bit harder. But honestly, it sounds really weird, but once that person dies, it's not really a person anymore. Like, you know, like their soul has left or whatever it is, whatever you believe in, but they're just sort of like a body that you take care of and you make sure that they're ready to do whatever they do. And as long as you're there to say like, hey, do what you got to do, leave, be comfortable. I like to say a little something to my patients when I'm sitting there with them, you know, hold their hand or something. A lot of our patients don't have family members with them when they're dying. So I just try to be there with them when they can be. And, you know, it's hard, but you get used to it, honestly. And it's just sort of part of the job.
Yeah, that's a really beautiful way to look at it, to kind of to flip the narrative and look at it as you are the last person with them. And so you get to make them comfortable.
Yeah.
Yeah. Thank you for answering that. Okay, can we go around the panel and just highlight a bright spot, what you love about your job, and then a challenge, something that you find very difficult. Let's start with Jacqueline.
One bright spot would be getting to work on so many different projects with so many partner organizations. So in public health, I feel like we are connected to a lot of different happenings in the community. So I get to work with a steering committee, which is made up of folks from different agencies, but also a number of clients who are on Medicaid. So, you know, they are the people that receive a lot of care in our community, and they get to help make decisions about what our programs and services look like. And it just feels really good to help, you know, get to hear that voice and help to elevate it and make decisions based on those folks, and just to have those relationships. And as far as a challenge, I would say that there are just a lot of needs. And I think, you know, whether we were in a pandemic or not, that would probably be my response. But I think coming out of the COVID-19 pandemic, we're going to see tremendous need as kids are returning into their school buildings after over a year, as people have been working reduced hours and haven't had the funds to feed their family nutritious meals, or they haven't had they haven't been able to exercise, or their routine has been disrupted for the past year. I think we're going to have a lot of challenges, let alone all of the issues related to the COVID-19 virus as it is. So I think the challenge is like that there's just going to be a lot of competing needs and really limited resources and staff and funding, and it's just a matter of prioritizing based on the most urgent and the most prevalent or common issues. So.
Okay, thank you. Lauren, what about you?
Working in primary care, I would say one of the definite highlights is you just really get to know your patients incredibly well. I said earlier, I had a fairly large panel over the years, and a lot of them had been with the doctor I worked for over 40 years. I knew grandma, I knew mom, I knew baby, you know, the doctor delivered my adult daughter, and then he delivered her daughter. And it's just watching the whole cycle. You know, I get my little newborns, and then I watch them grow up. I watch them like come in and get their vaccines to go to school. Like, like some of them are excited to see you and tell you about their life changes and everything. I mean, you just it's like you're part of the family. So that's, just wonderful about family practice. A negative is that there are some barriers. Patients need a lot of different things. Having such a big panel, everyone has different medical needs, and there aren't necessarily, there can be insurance barriers for coverage for things that they need, and community resource, limits. And we try to here at least, we try to help, find avenues, find resources for them. But there are definitely limits to what we can do. And it's really hard when we see a need that we can't fulfill for them, even though we know what needs to be done, but the resource isn't there for them.
Absolutely.
So that's probably the hardest thing.
Thanks. Sonia?
I think one of the favorite parts about my job is, sounds cliche, but changing someone's smile. It can make such a big difference and totally change someone's personality. I just worked on a gal last week, and she's retiring in a couple weeks, and she always wanted the smile of her dreams, didn't have a ton of money for maybe crowns or something really expensive. And I just kind of fiddled around, came up with some other options for her. And she just like totally transformed. It was so cool. So very emotional. I get emotional because you can see how it changes people's lives, and it's pretty cool. I think one of the more challenging parts is just dealing with staff, like owning your own business. That's a challenge. And I have an awesome team of women, but it's just tough. Like most businesses have an HR group that deals with staffing stuff. And again, I'm not trained on it. You kind of learn as you go. And then dentistry wise, I would say just it's physically hard. Sometimes you're working in kind of weird contusions for a while. And so just importance of taking care of yourself physically, but worth it, totally worth it. So
Great, thank you. Because we are running just almost out of time, shockingly, I'd love to shift the conversation towards hiring. A lot of the students on this call, like I mentioned, are currently in health sciences courses, and that's the career path they'd like to pursue. And so just by a show of hands, how many of you participate in any kind of hiring, be it application review? Lauren, you mentioned training, we'll count that. Interviewing, anyone? Okay. Jacqueline, okay. Sonia, even with your own practice, you don't do much of the hiring?
I do it all.
Oh,
Yeah.
okay. Okay.
Yeah.
So
Yeah.
that hand
Sorry.
was up.
Yes.
Okay. Okay, great. So I'm just curious what each of you look for in applicants. And whoever would like to go first, I invite you to do so. Who's it gonna be? Jack.
I can start.
Either way.
So for me, I feel like the kind of the criteria are often prescribed for me. It's not as if it's my decision, right? I feel like I'm tasked with being on the interview panel or with reviewing applications kind of thing. But the types of things we look for are just transferable experience. So even if we're hiring for someone, let's say we're hiring for someone who is going to be an opioid prevention specialist. That's a pretty niche topic area, especially, Eugene, Lane County is a pretty small area. So as long as there are other things that can relate or transfer kind of into that topic area, or they have the relevant skills, I think that's what I try to look for. So if they've worked with, maybe they haven't worked on that topic, but they've worked with the same types of populations, or they've worked in the same kind of setting. So just trying to look for that relevant experience, but it doesn't always have to be, it's often not like a perfect fit. And I think in public health too, a lot of folks have, different interests, and they evolve over time. And so there's a lot of opportunity to move into new topic areas and things like that. So I guess kind of on a side note, just if there is something that, I think in public health, it's okay to change your mind about what you want to pursue as a career. And that's one of the things I really like about it. It's something that's really science-based, and there's a lot of creativity and just a lot of need and topic area to cover.
Okay, great. Thanks, Jacqueline. And then Lauren, go for it.
One of the biggest things that I look for when I'm training someone is how comfortable are they talking to someone. It doesn't have to be medically related, just talking in general to someone they don't know, and how well they're able to, express themselves. It's really hard to make a really shy person more outgoing. That seems to be one of actually the hardest things to pull out of people.
Yeah.
And then just a willingness to make mistakes, but then let you know that they've made a mistake, or be accepting of a little criticism, and maybe just someone that's willing to maybe spend a little bit of time outside of, we do hire a lot of students. So I often send them home with kind of little short homework, specifically like medication knowledge, things like that. And if they're willing to do some of that when they're not there and I see it the next shift, I'm much more likely to talk highly of them to management later.
Okay. And to your first point, about someone being comfortable talking to patients, I feel like that has everything to do with building rapport and trust. If it's likely that a patient's not going to feel totally comfortable if all of their like check-in, I'm not sure what that's called, but all of, the first few steps when they walk into a doctor's office is just quiet. I feel like that might be
if the MA is scared, the patient will be scared.
Yeah.
So
yeah.
it's just the way it is.
So Kelly just put a great question in the chat. She asks if we have any suggestions for students who are naturally shy on how they might be able to work on that. I think a huge piece of that has to be confidence. Just trying a few times and it will get more and more natural.
Try waitressing for a little while.
Yeah.
I am not even joking. It's absolutely a confidence builder.
Yeah. What were you going to say, Sarah? I'm sorry.
I was away too. And
okay.
There's all that. So.
Okay, great. So trying kind of a customer servicey job first, maybe, just so you can get comfortable. That's a great suggestion.
Even like outside, if you can do something like that, a bunch of customer service jobs in school to like have, make it money. But it's also like an extra benefit. Really comfortable talking to people, to talk to people that are unhappy, and you just have to sort of look at your feet. Good option.
Your sound is doing that thing again, but I think I can recap. You might not do waitressing, or you might do it on the side, not for the money, but for the experience. Okay. Sorry, I'm sorry about your microphone. And then Sonia, what do you look for when hiring for your practice?
Experience is great, but I just hired another gal, and kind of what I focus on is more personality. I can do the training. If someone comes in totally wanting to learn the field, like that's great. We can train on the job and kind of get someone comfortable. I think what you can't train is if someone is confident. Confidence, I think, does come with experience. And just being shy, I was a little more shy kind of early on. And I think what helped me is just putting myself in situations that I was scared to death to be in. Talking with strangers, small talk, just getting comfortable. And then just working on those interpersonal skills, I think is huge, just especially in the medical field. I think we can all relate, as we've talked about, trust, all of that. Like people really, really want to feel heard and comfortable, a willingness to work hard, reliable, have a kind of a go-getter, self-starter attitude. There's a lot of time where I don't have the time to micromanage, nor do I want to micromanage. So just kind of jumping in, being willing to learn, and work hard, I think goes really far, even if you don't know the job specifically.
Absolutely. I'm shocked at how many times we hear that across all the sectors is we can train you. You just need to show up, willing to learn, excited to learn, show a little enthusiasm, and we'll train you. Yeah, that's great. Thank you. So we have 2 minutes left. We have 4 panelists, so fast math, 30 seconds each. What do you wish folks knew about your portion of the, and we lost Sarah. Okay, each of you get a little bit more time. But what do you wish people knew about your part of this industry? So for Sonia, it would be dentistry. What do you wish people knew about dentistry?
It's very art science blend. if you're looking into going into the field, I didn't realize how arty it was. And I love that. I love math and art, science, so.
Okay.
But that kind of comes with the territory. But you work with your hands a lot, and you're helping people and being creative, and that's so much fun.
Mhm.
And if you take away the science, if you enjoy that, you can get through school.
Okay, that's great. Thank you. Lauren, what do you wish people knew about medical assisting or family practice?
Well, with medical assisting, I don't know if people know, medical assisting is something that you work for a provider under their license. You have your own certification, but you do work under their license. So pretty much whatever they want to teach you to do, in addition to your skills you learn, in school, but you can learn to do anything. Like they can, if they're comfortable teaching you and letting you do things for them, you can do anything that they are willing to let you do and sign off on you doing as the practitioner. But working in family medicine, the other thing is, it's a lot of preventative. The goal is to help keep your patients from needing to go to the hospital. That is probably the biggest part of primary care.
Okay, thanks, Lauren. And Jacqueline, what do you wish people knew about public health?
Sure. So selfishly, what I want this group to know is that public health, if you didn't know, we're in a pandemic, and hopefully we're going to be getting an increase in our resources, and we'll be, I hope we have a boom of, needing to hire new folks within the next couple of years. I'm hoping that if we've learned anything from this pandemic, it's how essential our public health and healthcare workforce is, and that if this is something that might interest you, I think now is a great time to either kind of get an entry-level job in public health, or to consider studying it to get a job in a few years. I think that just the timing is really good if this is something that you're interested in. When I graduated with my master's in public health, it was during the 2008-ish recession, and things were really hard. But I just hope that young people have a much easier kind of entry point into the field over the next couple of years, thanks to COVID-19, actually.
Okay. Thank you, Jacqueline. Thank you for being here. Thank you for your time and insight. We really, really appreciate it. And thank you to everyone tuning in live. We will see you next school year. Enjoy your summer. It feels too early to say this, but enjoy your summer. And I hope everybody has a wonderful evening. Thank you.
Thanks. Bye-bye.
Bye.